Hello, everybody. I'm Michael Barasch. Thank you so much for joining us today. I want to thank Sam Frasina and Jimmy McGowan for helping us organize this, Barry McGarry and his group as well. And the bottom line today is just spread the word. So I know some of you are going to come on a little later, but we have a full agenda, so I want to get right into it.
The first thing that I hear from the non-first responder community in Lower Manhattan is, look, I'm sick, but I don't deserve anything. I'm not a first responder. I just lived here. I just studied here. I just went to school here. I just raised a family here. Your presence here was an act of courage and resilience. The first responders, I'm in awe. But I also am in great awe of those who came back to a war-torn neighborhood that was clearly toxic. We knew it, but you stayed anyway, and you allowed this area to grow and to become the hub. But it's your courage and your resilience that brought this place back. So please, I urge you, access what you are owed.
Over the last decade, we have all fought very hard so that everyone has access to the health care that they need. It is very important that every community member who lived anywhere south of Houston understands that you are covered. You are part of the group of people that have guaranteed health care if you have a 9/11 related disease.
I was on my way to work when the first plane hit. I was working for Goldman Sachs. I actually worked for them for a total of 21 years. I always thought that those programs were geared for the firemen and the police officers, but I'm one of the victims of that.
So we have taken on, with all of these advocates here, the task of trying to get everyone to understand that they have rights, and it is imperative that they sign up.
One of the really surprising things about our research is that an event in 2001 can continue to have echoes 17 and 18 years later, such that it is as though never smokers are smoking 2 packs a day.
My law firm represents over 15,000 people in the 9/11 community. And the majority right now are first responders, but every single day we hear from more and more survivors because we're doing this outreach. Basically, to be entitled to compensation, you need to prove that you were below Canal Street or on the Fresh Kills landfill, either caught in the dust cloud on 9/11 or for 24 hours during the month of September 2001, or for 80 hours, which is just 2 full work weeks between 9/11 and May 30th of 2002. And you need to get 2 people to sign an affidavit attesting to the fact that I saw him. I worked next to Joe. I went to school next to Francis. That's all it takes. There's a reason why my firm takes all this so personally. I have 6 young people who work for me who have lost a parent or a spouse as a result of World Trade Center toxins. 9 people in my law firm, including me, are cancer survivors. The information you get from us is going to be compassionate, and it's our pleasure to help you. So what I'm asking all of you today is we're going to be speaking about this deadline of July 29th, and I'm hopeful that many of you will know people and can get them to pay attention to that deadline. And before I forget, I want to thank Billy Ramaka, who's with us today. Billy, thank you for helping us organize this today. Billy is former vice president of the IAFF and the, I should say, and a FDNY or an UFA board member. Lee London, one of my partners, is with us today. Would you tell us what the most common illnesses are and what does it mean in red to be a presumption?
Sure. So I'm happy that everyone's joining us today. And first, I like to start out with when the Zadroga Act was created and the reason why Michael lobbied Congress so hard last year to get the Victim Compensation Fund and the World Trade Center Health Program fully funded to outlive us all is because these cancers and these respiratory conditions develop now. They can develop 5 years from now. And the presumption, what Michael was referring to in red, is that if you were there, if you responded to ground zero and you have the requisite amount of hours, your cancer is presumed to be related to your exposure on 9/11. That means that just because your family might have a history of prostate cancer or breast cancer, and your private doctor is telling you, well, I don't know if your cancer could be related because you have a family history of it, it doesn't matter. It's presumed it was due to your 9/11 exposure, and it's like lighting a match on kerosene. You are taking somebody who is already pre-exposed, and then with 9/11 toxins, your cancer is presumed to be caused by your exposure. So when the Zadroga Act was created, it was broken down into two entities. You have the World Trade Center Health Program on one side, and you have the Victim Compensation Fund on the other. All of these conditions listed in front of you right now are covered and certifiable and eligible under the Victim Compensation Fund. I'm going to start with skin cancer because, as everybody knows, skin cancer is the largest organ on the body. Skin cancer is developing now, basal cell, squamous, melanoma. It's all developing now, and you must go for your annual skin check because this is a condition that 3 out of 5 firefighters, cops that I speak to, when I say go get a skin check, they call me back and say, thank you, Lee. I went to get a skin check. Yes, it was a little basal that they removed, but that is compensable under the fund. And that's when you get the ball rolling to get yourself checked out, especially with what's happening with COVID, and especially the fact that all of you are immune compromised. You want to make sure you protect yourself. This is not just a cancer fund. It's also for respiratory conditions, asthma, GERD, interstitial lung disease. Many conditions are covered, and the fund and the Victim Compensation Fund and the World Trade Center Health Program will add new conditions based on more people joining the program and the more data that they have. So I just wanted to point that out. And again, any questions or anything such as, is this covered? Ask us. We're here and we have the database and records to answer your questions.
Let's start with Dana. Would you talk a little bit about the deadlines for making a Victim Compensation Fund claim?
Thank you, Michael. Generally, claimants must register a claim with the Victim Compensation Fund within 2 years of the date that the World Trade Center Health Program certifies their illness. And you'll hear more about that. For families who have lost someone to 9/11 disease, the deadline is even more onerous. It's 2 years from the date of death. And it's a tough deadline because so many families don't even know that they are entitled to these benefits. You as responders may have heard of it, maybe not, but your aunts, uncles, cousins, friends, neighbors, everyone who went to school, worked downtown, they also are. The Special Master of the Victim Compensation Fund recognized the unfairness to victims and to families. And so the deadline has been extended to July 29, 2021 for everyone. So even families who have lost someone more than 2 years ago, even someone whose illness was certified more than 2 years ago can register, but only until July 29th, 2021.
This is Dr. Luft from Stony Brook. Basically, he's warning everybody what Lee talked about earlier. Do not miss your annual appointments, whether it be for your prostate exam, your colonoscopy. And it's because the coronavirus is a respiratory illness. Those with respiratory problems, which almost everybody in the 9/11 community has, you are particularly at risk. So be safe. So we're very lucky today to have Liam Lynch of NICOSH with us. Liam, say hi and tell us a little bit about NICOSH and the World Trade Center Health Program.
So today I'm going to talk about the health care program, right? We're talking about two programs today. I'm talking about the healthcare. And as the slide says, this is for 9/11 responders who are in the healthcare program. It is a free annual exam from experts who are specialized in caring for this community. And, that alone is worth being a part of this healthcare program, is that it's a free monitoring exam. You're getting checked up from experts and doctors, physicians, PAs who have worked with this population for years. They know the unique circumstances of their members and of their patients. And a lot of times the conditions that are related to 9/11 exposure are extremely unique. It's not just regular general asthma, right? It's asthma related to 9/11 exposure. And so that it needs a special treatment program, right? And so if you're part of the healthcare program, all treatment related to conditions that are certified, and your conditions have to be certified in order to be fully covered. All medical tests, doctor visits, surgeries, prescription drugs, I know that we have a lot of union workers who are our members, and so union workers have great healthcare, but it's not completely comprehensive, right? You have some out-of-pocket co-pays, some expenses. So in this program, that will all be covered. So all the co-pays related to your prescription drugs, and there's also a very robust benefits counseling program that you can be a part of. And, we're not just talking about physical health conditions, we're talking about mental health conditions as well, right? And that is covered, so panic disorder, PTSD, this is taken very seriously in the program, and they have a lot of wonderful therapy, group therapy programs that people can be a part of. And a couple more things I just want to say, early detection saves your life. And that's why the annual monitoring exam is so important. There is a long latency period between the time that you're exposed to the time that you develop some conditions. If you're exposed to asbestos today, you may not experience, and develop a condition 30, 40 years from now, right? And we're not 30, 40 years out from 9/11. And lastly, this program is in all 50 states. There are providers as part of what we call the Nationwide Provider Network. It's run by Logistics Health Incorporated, LHI, and responders and survivors are receiving care in all 50 states. So you do not have to be, work within the New York metro area to receive care.
Lee, let's go back to you. Talk about the Victim Compensation Fund and the personal injuries benefits, not the death benefits.
Going back to the Victim Compensation Fund, one benefit that they have, which is an amazing benefit, are out-of-pocket medical expenses. Cancer, respiratory, it's expensive to treat. And that's why the Victim Compensation Fund is an amazing benefit to have. So we encourage everybody to save your receipts anytime you paid for something out of pocket that wasn't covered by insurance or wasn't covered by the health program, save it all. Another claim that I can make is a non-economic loss claim for your pain and suffering. And these claims can range based on severity. One of the biggest reasons why our firm had the fund extended and permanently funded was because conditions can change. You can have two people diagnosed with asthma and one person had 5 surgeries and the other person uses a nasal rinse once a week. They will get different awards, and the awards can range from 20 to 90,000 based on severity. So for non-life-threatening illnesses, for non-cancer conditions, the highest amount someone can receive is 90,000. It ranges, but you can always go back and amend your claim. So if you accept an award for 20,000 based on your asthma today, and then next year you have 5 surgeries and you go to the ER and it gets much worse, we can amend your claim for an increased award. You're never waiving your future legal right by accepting an award. And that is the best part about this fund, because God forbid you get diagnosed with prostate cancer, bladder cancer 10 years from now, we'll be there to submit your claim and to help you get that increased award. And you'll already be in the program. You've already started it. You don't want to start this when you're sick. You want to start this when you're together right now, when you can get the proof of presence documents together, you can get your medicals together, and you can move forward.
Explain what you mean by proof of presence documents.
Okay, so proof of presence documentation is a requirement under the World Trade Center Health Program and the Victim Compensation Fund. They have different requirements, but this is bringing you back to when you were responding at ground zero to your exposure on 9/11 and having the proof to show the government, yes, I was there. And that proof can range from affidavits to employment verifications, to memo books, to pictures, to ID badges. But the affidavits are key. And the affidavits are key because it's somebody that the Victim Compensation Fund can call on the phone and say, hi, were you there with Mr. Johnson? Were you there? And describe what you saw, what you smelled, what you heard down there during that time. Because we want to get this proof of presence documentation together now when you're healthy, and you don't want to leave it up to anybody else to prove your presence during that time period.
And Lee, I also wanted to circle back now to, we're very fortunate to have FDNY Deputy Chief Richie Alley's with us today. Richie was also a proud member of Local 854 and a trustee of the UFOA. And Richie, thanks for joining us. I wanted you to, you heard what Liam said about the health program. You've been in the health program. And I'm sure you know some of the frustrations with it. Not everybody loves it, especially my friends up in Yonkers and Mount Vernon. I do hear the complaints sometimes. But can you tell us from your perspective, why should everybody get into this? And what's been your experience?
So who really has anything good to say about their healthcare in general. Liam had touched on the point earlier that as civil service union employees, unions always negotiated good health benefits as opposed to salary increases. So nothing is perfect though. And so now as a member, I've enjoyed good healthcare most of my life. And but I've always, had to pay co-pays. There's a lot of out of pocket that goes along with that. As a 9/11 first responder now being in the health program, I get the benefit of all of that. And anything that I have 9/11 related is completely free. I'm pretty serious about my health. I'm married to a nurse, but in our jobs, it's life and death. And the one thing that you can do is to make sure that your health is at its maximum that it can be. And how do you do that? By getting checked out. So what I do is I have an annual exam using my good medical coverage. 6 months later, I have my World Trade Center medical that's scheduled. So in the course of that, I was picked up by a World Trade Center health program doctor, had noticed something on my neck. It was really very small, like a pinprick. And it's not something that's screened for in the World Trade Center health program. That's why I'm glad that Lee pointed out it's the most common skin cancer. So we tell everyone, use your health coverage to go to a dermatologist at least once a year. But anyway, my private physician had missed it. My wife, who's a nurse, had missed it. I went to a dermatologist and it turned out to be a basal cell carcinoma, which left unchecked could have ran into big problems. As small as it was, they had to go in 4 times, which left me with a dozen stitches and a nice little scar on my neck that makes me look like a tough guy. So the members that I see, police and fire, we're all tough guys and gals. You feel good. Maybe you don't want to know and you don't want to leave well enough alone. Those are the people that run into a problem because now all of a sudden something develops and they go and they get checked out and they haven't given their health provider the most adequate chance to save their life. These are the people time and time again that run into a problem. You have to take advantage. This program is here for us. It was fought for by our international union, by our state union, and all of our locals, and the New York State AFL-CIO. Enormous amount of time, energy, and money was spent to get this law in place. So please, if you do anything, utilize the benefits that you're entitled to.
And again, this is not an adversarial situation at all. They just want to see an affidavit from someone who says, hey, I was with this other volunteer. We came down from Yonkers. We came down from Syracuse. We're at Utica, wherever you came from. They just want someone that they can call and say, hey, were you with that guy? That's it. You're not going to be grilled in court. This is not a court system at all. As I said, they want to help you. Dana, would you and Dom please tell us a little bit about the death benefits? Sadly, not a day goes by without one of our clients dying of a 9/11 illness. So I really want to make sure you all out there help us spread the word about these benefits and the deadline.
With respect to these awards can be very, very substantial. They can be in the hundreds of thousands of dollars, the deceased claim awards, and they can be in the millions of dollars. Because they compensate families for the personal injury award if their loved one passed away without ever bringing a personal injury award to the VCF. And then they include a deceased award. And the deceased award includes lost earnings. It can, if the person was died before they had worked their entire life. It can include non-economic loss, pain and suffering, essentially, for not only for the person who passed away for their estate, but for some of the survivors. If there was a surviving spouse, if there were dependent children, they're all entitled to separate $100,000 awards. You see that in the slide in front of you. The family is also entitled to an award for replacement services, meaning compensation for the things that their loved one used to do around the house that because their loved one passed are no longer being done. Somebody else has to do them, or you have to pay somebody to do them. The VCF provides compensation for that. And then there's, as I mentioned, there's also a pain and suffering award for the decedent, both on the personal injury side and on the decedent side. And there is reimbursement for funeral expenses. All of these categories, you add them up, and as I said, they can be in the hundreds of thousands of dollars and they can be in the millions of dollars. And Dana is going to discuss with you what we can all do now to help our families should we ever pass away from one of these 9/11 illnesses.
So the most important thing you've already heard, and that is register. Get in the program, get your proof of presence, because not only is it hard for you to find your witnesses 50 years from now, if you leave it to your family, and we see it all the time, that's a very difficult task for them to track down the people who saw you there. They weren't there with you and they don't know. So for your family, it's extraordinarily important for you to get in the program to protect their rights to these benefits. The other thing we recommend for everybody in the 9/11 community is get a will. And the reason you need a will is a part of this award, if your family ever needs to file, will pass through the will. And you get a say in where that award goes. And you can decide where it's most needed and avoid family fighting and just make the process a lot smoother for your family. So we recommend that for everybody. Always keep in mind when you're thinking about planning, have you updated your beneficiaries? Please do that. Think about this regularly. If your beneficiary is your dog, then your dog is going to get your bank account. Don't do that. Always be thinking about planning for your family. It's so important for all of us, and especially for all of us in the 9/11 community.
Dana, thank you for that. And those of you who are on today listening, who are our clients, we do free wills for all of our clients. We do free wills for all firefighters and cops. So please take advantage of it. There's no reason not to do it. I know you think that lawyers have a very dangerous job, and sometimes it is. I could have a paper cut sometimes, but your jobs are arguably a lot more dangerous. And yet only 10% of responders have a will. It's crazy. I know you guys think you're bulletproof, but please let us do this for you. Protect your families.
And one more thing, Michael, just on that front is the person you name in your will as the executor is the one who is going to bring this claim. Talk to your family and make sure they understand their rights. Don't take for granted that they know that they're entitled to this.
Okay, great. Thank you, Dana. Let's go to the last slide. Dana, you and Dom have both touched on it, but Dana, would you take us through this?
Spread the word. This is what we want you to do now. Take this information and don't just file it away, but talk to people, share it with the people you know. You're on Facebook groups, you're in support groups. Spread the word about the deadline and spread the word about these programs. And register for the World Trade Center Health Program. You're entitled to, as responders, you are entitled to medical monitoring. It's so valuable. Please take advantage of it. Get your proof of presence in order and register for the Victim Compensation Fund. And I'll let Dom take it from there.
Thank you, Dana. The last 2 points are what you heard at the outset. You heard Lee tell you not to fail to go to the doctor. During this pandemic, a lot of people are canceling their appointments. It's understandable, but don't cancel your appointments. We've had doctors on these panels before, and they're always telling everybody, please don't cancel your appointments. Go to the doctor, get your skin checked, get your colonoscopy, like Richie said. Get your annual checkups, and like Dana said, get a will, get a healthcare proxy. Tell your family about these rights. Get your ducks in a row, like Richie said.
I want to follow up. James Steiner, one of our associates, is on today also. And James, there was a slide we briefly touched on, but can you tell us a little bit about what the Victim Fund is doing for people who are in stage 4 cancer, which is the worst stage you can be in?
Absolutely. And unfortunately, it's something that we have to talk about because when you're talking about cancer in the 9/11 community, what you're really talking about are these aggressive cancers that a lot of people refer to as cancer on steroids. And unfortunately, they develop very quickly. And what you see are people that are in late stage 4 cancer. And one of the best things about the Victim Compensation Fund is that they have a program in place to expedite claims for people where time is of the essence. So yes, you want to get certified by the World Trade Center Health Program, because when you're certified, the program is going to cover the cost of treatment and medication for that condition for the rest of your life. But sometimes that can take time. And when you're talking about these aggressive cancers, we are able to actually go directly to the fund and have them verify that that cancer is 9/11 related directly. This way, we use your medical records, we use your prognosis reports from your doctor to show the fund that they must expedite your claim. And now you'll be able to get compensation while you still have control over it, and you're able to do what you want, and you have that peace of mind knowing that your family is taken care of.
Liam, I wanted to follow up on something with you. You talked about the nationwide health program that's also available in Puerto Rico. We have so many clients who, when they retire, as Richie likes to say, they got the best of both worlds. You know, they move down to the Jersey Shore, some of them, or they stay in Westchester or upstate New York, but then go down to Florida or North Carolina during the cold weather. What do they do about getting treatment if they're a snowbird?
Yeah, absolutely. It's such a good question, and I get this question all the time. Like you, I know a lot of snowbirds. So it's a case by case basis. So in general, you are the program requires that you are one clinic is your home base. And so, if that's home base is Mount Sinai or Rutgers or whatever, or a clinic down in Florida. And then you are entitled once a year to switch that clinic. However, with the snowbirds, I do know of folks that, they take a large, in the winter, they're down in Florida, they take their appointments there. And then once a year they come up and they like to go to Mount Sinai to get their, big annual exam. So it is a case by case thing, and definitely an option for folks who are in that situation.
And what about our friends who live in Syracuse or Utica? Are there clinics up near where they are?
Absolutely. The Nationwide Provider Network says that they will hook you up with a provider within 50 miles of your home. And I know plenty of responders who are receiving care upstate right now.
That's great. Lee, I'd like to follow up on a question that I thought of when you were speaking. And, I mentioned that it's a non-adversarial situation, but if you're not an attorney, maybe you don't understand exactly what that means. What is the single biggest challenge that you've had doing these appeals or hearings to try to get I'm not talking about the New York City firefighters, cops. I'm talking about all the guys who came from out of New York City. What's the biggest challenge you're seeing, and what are these hearings like?
So, great question, Michael. So the Victim Compensation Fund realizes that many of these presence documentations might not be there anymore. So, and what we're dealing with now with COVID is many of these witnesses are passing away before they can even tell the VCF about their partner's presence. So that's why it's so important to write down everything now, get these documentation and proof of presence together now. But the Victim Compensation Fund has eligibility hearings, and these are non-adversarial hearings where you used to go to the Victim Compensation Fund office. Now they're held over Zoom, and they go through your exposure, the details. They go through certain witnesses, pictures, IDs, because not everything, your exposure is not written down on a piece of paper. Everything you suffered from what you saw, what you smelled, what you heard that day needs to be testified to these hearing officers that will hear you out. They will go through it. They've heard this before, and they want to hear it directly from you and directly from anybody else that might have saw you that day, and really vet out your presence. This is something where the Victim Compensation Fund does an amazing job to make sure that you feel okay, you feel comfortable, but also get to the crux of what your exposure was as a volunteer, as a first responder. And then we really paint the full picture for the Victim Compensation Fund.
Matt, would you like to talk to us about some of the questions that are, and we'll have somebody answer some of the questions that have been asked?
Yeah, we have a lot of questions. Someone said, if a responder is already registered with another firm, can they switch to our firm?
Generally, there are about a half a dozen really good firms out there who I would have no hesitation at all, and we do this all the time, and say, you know what, this law firm that you're representing, and maybe it's a little frustrating, they don't return every phone call, especially during COVID, but we'll urge you to stay with your attorney. But sometimes when, claimants are so frustrated or they feel they're not being listened to, yes, we have a very good relationship with almost every law firm. We'll call up that firm and say, hey, look, this client of yours is leaving no matter what. We'll take it on and, we'll share the fee with you. It's not, and the fees, by the way, are set by Congress at 10%. So no law firm really is going to be that upset about losing a case. They'll feel worse about the fact that they didn't pay attention to the client. But yes, you can switch attorneys if you need to. Next.
What is the possibility of NIOSH and NIH putting the 9/11 community forward in the COVID vaccine line?
Oh, and Liam, I'm going to dump this question on you and see if you've heard anything, because I hear a lot of rumors, and we're arguing that there should be a special hotline for 9/11 responders. Because remember, the reason so many 9/11 responders are sick today is because the government lied to us about the quality of the air. Remember that when Christine Todd Whitman said the air is safe to breathe? So I feel like it's a moral obligation by the government, and that's what I've been arguing whenever I get interviewed. But I'd like to know what you have heard.
Yes. So the responder steering committees and the steering committees of the healthcare program are pushing very hard for this population to be prioritized with vaccines. And so this is to be determined, but there are people in the steering committees who and the leadership in the program who are really pushing for this to be prioritized. So I hope to have something very soon, have an answer on what's happening with that.
Lee, would you talk a little bit about what associated conditions are? Because I think that addresses the question that one of our participants had today about head problems that are not just caused by rhinosinusitis, but separate.
Sure. So many conditions, as you will know, can be associated to other conditions that are eligible. So like sleep apnea on its own is not compensable on the fund. But if it's associated to GERD or upper respiratory or obstructive airway, you can get obstructive sleep apnea certified. Just like I have many clients that have upper respiratory, it's very severe, and the medication that they're on due to their upper respiratory could cause diabetes. Diabetes can be certified not on its own, but as a condition, associated condition to the upper respiratory. So you have to make the link to an eligible condition. That's why, in order to get a condition added, the World Trade Center Health Program, they need the research. They need the research that more people are suffering from this. That's why you have to encourage people to join the World Trade Center Health Program, sick or healthy, because the more data they have, the more likely they're going to add new conditions. So if you are among 5 responders and all of you are suffering from the same head pains associated to your upper respiratory, you all have to bring that to your social worker's attention, to the health program's attention, and say, look, all of my crew is suffering from the same condition. I want it certified as an associated condition to my upper respiratory. And if you're not going to do that, I want to know why, or if you're lumping it into a new category that's not certifiable. Liam mentioned autoimmune. Autoimmune is certifiable as a result of cancer treatment. So if you have a very horrible cancer and you're going through chemo treatment and you get an autoimmune condition linked to that, it can be certified through your cancer treatment as an associated condition through your cancer, but autoimmune on its own is not covered yet. And The only way they're going to do it is by having the research.
Will this affect my pension?
Richie, perfect question for you.
Yeah, good question. This comes up from time to time with the municipalities that have cancer legislation. So if you're in a fire department, within the state that has a cancer bill, the concern is, if I file a claim with the Victim Compensation Fund, will my city fire department and the city agency say that the cancer was a result of exposure in New York City and not where I am a firefighter or police officer, whether it's in New York or whether it's in New Jersey, anywhere else in the country? And the cancer legislations are always presumptive. So your municipality has to accept the presumption that your cancer was from your firefighting duties in your city. The federal government, on its own and independently, assumes that your cancer is a result of your exposure at ground zero. So one does not countermand the other. So it's a really serious, question, and it's held other people back in other cities. Michael, I, and Billy actually went out to Chicago, which had a huge contingent that came to New York. There were over 500 responders there. They have a cancer bill, and it was very, very big for them. And many members had not yet put in a victim compensation fund claim because they were afraid of losing their disability because Chicago, the city of Chicago, had disabled them. So one has nothing to do with the other.
I'm afraid that that's going to end our question and answer session. I know many of you have other questions. Again, please go to 911victims.org. Call us. I hope it came across how sincere we are about protecting your rights, about helping you help us get the word out there to other widows and widowers and families who have lost loved ones. As Dom talked about earlier, if someone died in 2005 or 6 or 7, well before cancer was linked, their family is entitled to this compensation, which could really be financial security for them. So thank you so much for listening in today. Help us spread the word, and we're here for you. Bye-bye, everybody. Be safe.